Hello, my name is Dr. Dewan as Raja. Today I will discuss about alpha-thalassemia. Alpha-thalassemias are relatively rare in the Western countries. They mostly occur in Southeast Asia, Southern China, and the Middle East. Alpha-thalassemia is a genetic disorder that affects hemoglobin, and hemoglobin is responsible for carrying oxygen. It is caused by mutations in the genes that provide instructions for making alpha globin chains of the hemoglobin. Normal hemoglobin is composed of 4 protein chains, 2 alpha globin chains and 2 beta globin chains. Alpha-thalassemia results from a decreased or absent production of alpha globin chains. The severity of the condition depends on the number of affected alpha globin genes. Etiology and types. Etiology means cause. Alpha-thalassemia is considered an autosomal recessive disorder, but inheritance is complex because the alpha globin chain production is controlled by 2 genes, HbA1 and HbA2. Several mutations can result in insufficient amounts of alpha globin available for combination with the non-alpha globins. There are 4 alpha globin genes, 2 on each copy of chromosome number 16. The severity of alpha-thalassemia is classified into 4 main types. Alpha-thalassemia silent carrier, also called alpha-thalassemia minima, also called alpha plus trait. In this condition, one alpha globin gene is missing or mutated. People with this form of alpha-thalassemia usually do not show any symptoms and lead normal lives. It is often discovered incidentally during routine blood test. So alpha plus trait or alpha-thalassemia silent carrier or alpha-thalassemia minima, a person can have normal life. It may not be discovered, okay, and almost no symptoms. So we have some other type of alpha-thalassemia. This is one is HbH cell in a blood smear stained with brilliant chrysal blue. Here 3 gene has been lost in HbH. 3 genes is lost, and image from peripheral blood smear stained with supravital stain showing hemoglobin H, inclusion dispersed blue granulation here, okay, and Haynes body, larger one, this and this Haynes body inclusions. Hemoglobin Bart hydrops fetalis, here all 4 gene, alpha globin gene will be lost, and we'll see this picture. This is the neonate. There is every chance of stillbirth. There will be intrauterine demise because there is no fetal hemoglobin. The blood film of neonate with hemoglobin Bart hydrops fetalis. The baby will found edematous, showing anisocytosis, different size of the RBCs here. We'll get that. We'll get poikilocytosis, different shape. and numerous nucleated red blood cells will get a lot of red blood cells with nucleus. Okay, so this is the features of Hydrops fetalis. Will get nucleated red blood cells, will get different shapes, size of red blood cell, we may get some target cell like this. Okay, so these are the features of Hydrops fetalis. Okay, so again we go there. We just discuss normal or mild anemia, mild macrocytosis. Then alpha 0 trait, we have 2 gene is missing here. There will be mild anemia, hemoglobin less than 10 gram per 100 ml. RBC size will be around 60 to 70. Normally it should be 90. Hemoglobin A2 may be less or may not be less. Like also we may get HbH bodies. Rarely we may get it. Okay. Then we have the hemoglobin H disease. We have 3 gene is missing. 1, 2, 3. There will be jaundice, that is RBC will be broken down, the bilirubin will come out, splenomegaly, spleen will be enlarged, mild anemia, not mild here, moderate anemia, 7 to 10 gram per 100 ml, microcytosis, RBC size is small, hemoglobin A2 will be decreased, hemoglobin H will be increased, and we'll get hemoglobin H bodies. This is due to precipitation. Hemoglobin BART, all 4 gene is missing. There will be edematous, full of edema in the abdomen and also serous fluid. We'll get the dead baby. Okay, Hydrops fetalis. There will be cardiac failure and death. Okay, so we got the different genotype. Phenotype is the expression of genotype like this. And this is the nomenclature. And this has been taken from Learn Him. They have the credit from Google Images. We are continuing the types. We got type 1, that is minima. Here type 2, alpha-thalassemia trait. 2 alpha globin genes are affected in this case, as we discussed. People with alpha-thalassemia trait may experience mild anemia, but often goes unnoticed. The condition may be discovered during the routine blood test or when investigating mild anemia. Then the worst of all is the hemoglobin H disease. Okay. Actually, this is the third worst type. Okay, this is the number 3. We have the worst was the BART, number 4. Number 3 is worse than that of number 2. Hemoglobin H disease, 3 alpha globin genes are affected. In this more severe form of alpha-thalassemia, individual with hemoglobin H disease may experience moderate to severe anemia. Look at that. Here there is severe anemia. Here there is mild anemia, maybe a little bit moderate anemia, but here is severe anemia, jaundice, and then enlarged spleen, splenomegaly. Symptoms typically appear in early childhood. Okay, but in case of beta thalassemia, expression may not be in the early life, maybe in the adult life. Alpha thalassemia major, this is the worst of the worst of all type of alpha thalassemia. Hydrops fetalis in severe form, all 4. Here we have 4. Alpha globin genes are affected. This condition is usually incompatible with life, and affected fetus may not survive to term. There may be intrauterine fetal death even before the delivery of the baby. If they do, they often die shortly after birth. Unlike patients with beta thalassemia major, patients with severe alpha thalassemia are symptomatic at birth because they can't make hemoglobin F. How can you diagnose alpha-thalassemia? By laboratory test and genetic testing. Okay. In the laboratory, we will find microcytosis. Size of the cell will be less than 90 micron. We have seen here 60 to 80 around. The size, the MCV, mean corpuscular volume, is less than 90. Okay, and cell size is less than 7.2 micron in diameter. Microcytosis in the absence of iron deficiency. Hemoglobin electrophoresis shows normal findings except for the presence of hemoglobin H disease. In that condition, the hemoglobin electrophoresis will not be normal. We need genetic testing. Okay, so we'll do diagnosis by laboratory test and genetic testing. Laboratory tests include blood test and also looking at the RBC size, RBC mean corpuscular volume. We also look for hemoglobin electrophoresis. Okay, it is normal except for the presence of hemoglobin H disease. Okay, alpha-thalassemia is more prevalent in population with a higher frequency of consanguineous marriage. People marry first cousin, such as certain Mediterranean, Middle Eastern, Southeast Asian, and African population, usually East African population. Management may include supportive measures such as blood transfusion, specifically hemoglobin H, hemoglobin BART. HbH is third type of alpha thalassemia and fourth type of alpha thalassemia need blood transfusion. In severe cases, we may need bone marrow transplantation. Genetic counseling is often recommended for families with a history of alpha thalassemia to understand the risk and make informed decisions. And that's all about alpha thalassemia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.